afternoon, everyone, and welcome to this week's Social Security show on Cable Access Network TV. This is an interactive show, and our phone lines are now open, so please feel free to give us a call at 312-738-1060 with any questions that you may have. We have an exciting show lined up for you today, but before that, we have an important message about our online services. It's June and the weather is really warm outside. Take some time to enjoy the weather and avoid any wait times at your local Social Security office by visiting us at our website at www.socialsecurity.gov. Social Security offers many different services to the public, and they're free and definitely secure. Doing business online with us will save you that time to enjoy the beautiful weather out there. Today we'll be talking about Medicare, the new Medicare card, and some do's and don'ts to prevent fraud in regards to your new Medicare coverage. Before we get started, I'd like to introduce myself. My name is Joanna Glazer, and I am a claims specialist at the Chicago Lawndale Social Security office. I'll be your host for today's edition of the Social Security Hotline Show. And my co-host for today is Mr. John Marshall. Hi, John.
Good afternoon, everyone. My name is John Marshall. I am the Chicago Metropolitan Northern Indiana Area Working Centers Coordinator and SOAR Homelessness Coordinator for the Social Security Administration.
Also joining us today is Brenda Delgado from the Centers for Medicare and Medicaid Services.
Thanks, Joanna. It's my pleasure to be here, and I'm going to be joining the show and giving you some updates on the new Medicare card. I'm the External Affairs Liaison at the Chicago Regional Office for CMS, which is the Centers for Medicare and Medicaid Services.
Thanks, Brenda. Thanks, John. Hope we have a great show. So just to let you know again, this is an interactive show and our phone lines are open now. We have Ms. Dolly Robinson with us today as our phone technician, and she's waiting to receive your phone calls with any questions that you may have. So please feel free to give us a call at any time. The phone number is 312-738-1060. Each show we broadcast has a special topic that we think will be of interest to our viewing audience. Today's topic, as I mentioned earlier, will be all about Medicare, the new Medicare card, and some do's and don'ts to prevent fraud in regards to your Medicare coverage. So let's get down and give everyone some information regarding Medicare in general and the new Medicare card. John, can you help us out with that? Can you tell us what's Medicare?
Well, actually, Medicare is a federal medical coverage program that's under the Social Security Act. It's actually Title 18 of the Social Security Act, and it is health coverage for people who that are over the age of 65, or if they're under the age of 65, people that have disabilities after 24 months after their date of eligibility. And there are other people that receive Medicare if they have end-stage renal disease, or if they have kidney failure or kidney transplant, or if they have Lou Gehrig's disease, ALS. Now, there's actually 4 parts to Medicare. The first part is Part A is hospital insurance, and so whenever you go to the hospital, you're covered with Part A of the Medicare. If there's also Part B of Medicare, which is the supplemental medical insurance for doctor's visits and for medical treatments, and then there's Part C. Is normally that's the supplemental medical insurance. That's options that tries to take up the other 20% that Medicare doesn't pay for when you're hospitalized or you have any medical coverage. And then there's Part D, and Part D is the prescription drug for your prescription drug medications. And now, mind you, you can get extra help to try to get Medicare Part D if you have less than $18,120 as an individual, or you have, as for a couple, you can also get it if you have $24,690 for a couple. And the resources that we look at when we look at extra help for Medicare is $14,100 for an individual and $28,150 for a couple. Now, people normally get Medicare when they're 65 or older. As soon as you get age 65, we'll start sending you your Medicare card. The spouse can also potentially be eligible for Medicare if they're, if they were married to someone that's worked at least 40 quarters or 10 years. Now, you may purchase Medicare if you're a U.S. citizen and have not worked, the 40 quarters or the 10 years, or if you're a legal alien admitted for permanent residence, you can and who've lived in the U.S. for at least 5 years, or and these are people that are called voluntary enrollees. Now, again, if you are receiving Social Security disability insurance benefits, you have to receive 24 months of eligibility for Social Security disability insurance to become eligible for Medicare. And Medicare is a red, white, and blue card, and we'll talk about later on the changes on that red, white, and blue card later. Now, in terms of how do if you are, as soon as you get 65, you are going to mail you your Medicare card. Now, if you can opt for Part B, or you could opt out of Part B. And normally the premium for right now is going to be $134 a month. That normally is going to be taken out of your Social Security disability insurance check or your Social Security retirement check. You can opt out of Medicare Part B if you have some medical insurance of your own, or if you have private medical insurance, and so you wouldn't have to pay the $134 worth of a premium. However, at any point where your private insurance stops, you could come in and start your Part B. However, you can be penalized if you do not come in and start your Part B on time. One of the things that people always wonder about when they're dealing with Medicare is, why is it that my private insurance is asking me to get my Medicare when I become 65 or when I'm disabled? Partly is because normally Medicare is going to be the first insurer, the first person the first company that's going to get that's going to pay for your medical services, and then the other private insurance or other insurance would normally take up the slack. So normally the private insurance always wants you to file for your Medicare or get your Medicare once you're eligible for it.
John, may I ask you a question? So how much time does a person have after they retire from their employer to come in and sign up for the Medicare and not be charged any type of penalties?
Well, normally, people, there's an 8-month period because of the active employment ends, or when the group health coverage, ends, and whichever comes first. So ultimately, they can go. And as soon as I would advise people, as soon as they know that their medical coverage is going to stop, they would contact the Social Security Administration so that they can, start the supplemental enrollment for for Medicare. Normally, the general enrollment period, however, is from January 1st to March 31st every year. So you can have a general enrollment period where you wouldn't have to really deal with penalties then.
Okay. Now, is there special paperwork that's needed to sign up once you stop working with your employer and you stop having the group health plan coverage through your employer?
Yes, there is, and you need to come to the Social Security Administration and have that done. Normally, when you become 65 and at the initial time when you become eligible for Medicare, it's automatic. You don't have to file any paperwork or anything like that. And the same thing for people with disabilities. Once they get to the point where they reach their 24th month of eligibility, they'll be eligible for that Medicare card as well, and you wouldn't have to file for any documents. It's only when you come in the middle of either you didn't get your Part B benefit and because you have a private insurance, your insurance stops, or if you didn't, your insurance stops and you opt out of it for whatever reason, and you decide that you want to enroll in again. It happens a lot with veterans. Normally, veterans get covered with the you're covered by the VA. And sometimes, they opt out of Part B, and then they decide, well, hey, maybe I might want to have Part B in order to go to other hospitals and go to other, do other things and have other doctors outside of the VA system. And so they'll come in the general enrollment period and apply for their Part B.
And if you enroll in the general enrollment period, when does that coverage begin?
And normally, when you enroll during the general enrollment period, remember that enrollment period is January 1st to March 31st. Your first eligibility for Medicare will be in July.
Okay. And if you are a person that would have a penalty, how much is the penalty?
Normally, the penalty is 10% for the voluntary enrollee who does not elect Part A, or 10% for the Part B premium charge for every 12 months the one was late in enrolling for the benefit.
Okay. So I think that just goes to show that it's very important that when it comes around time of the age of 65, keep in mind, if you're already receiving Social Security benefits, you'll automatically be enrolled in Medicare. And we have a caller on the line. Hello, caller. What is your question?
Yes, good afternoon. I currently have Medicare A and B, and I'm on severance from my job, so I'm covered with insurance with them until the end of this month. So I'm going to need to pick up insurance starting July 1. Do I need to come into the Medicare office in order to do that, or what should I do?
So you have Part A and B?
I have Part A and B right now.
And so Part C is being taken care of by your employer right now?
I have health insurance still with my employer through my severance plan.
Okay. So it may be that you might find... Go ahead.
Yeah, if
But
you already
I
have
will be-
Medicare A and B, then you're all set. If you want to pick up a Medigap policy maybe, because Medicare only covers 80% of most of your bills, then you can go ahead and pick up a Medigap policy now, because your severance plan is about to end next month. You can enroll in a Medigap plan now.
What is a Medigap plan?
So Medigap is extra additional insurance that fills in the gaps of what Medicare doesn't cover. Medicare covers
Is that
about...
the same as a supplemental plan?
Yeah, it's a supplemental plan, exactly. So Medicare would cover usually 80% of most of your bills, unless it's like an inpatient hospital stay, and then you would still be responsible for that 20%. Right now, your employer insurance may be picking that up, but when that finishes, either you could be budgeting for that extra 20% whenever it is that you go to the doctor or get any medical care, or if you wanted to buy supplemental policy to cover that 20%, then you can do that now and pick that up. There's many plans available, and you can call 1-800-MEDICARE to compare the plans. But it's optional. If you don't want to pick up a Medigap plan and just choose to budget yourself to pay that 20% and not have to buy extra insurance, you have enough coverage with just Medicare A and B. So it's just your choice if you want to have supplemental policy to cover that 20%, or if you're comfortable just having Medicare A and B, you could be set with just with that.
And will that also cover the Medigap? Does that cover for prescriptions, or do I need to get something for that as well?
No, so Medigap doesn't cover prescription drugs anymore. You would be shopping for a Medicare standalone drug plan. So you can also call 1-800-MEDICARE 24 hours a day and have them choose what drug plan covers all of your drugs, and then you see which one might save you the most money. Maybe it's more important for you to pick one that has a special pharmacy or has a network pharmacy that you prefer to go to, and you pick that plan now. Every single year, then around wintertime in October and November, you'll be able to change that plan if you want to. We always encourage you to compare your drug plans every year because they do change, and maybe one that worked out for you this year might not be the best one for you next year. But you can call 1-800-MEDICARE, have your list of medications ready with you, and tell them, these are my medications, can you help me find a drug plan?
Thank you so much. This has been very helpful.
Mm-hmm.
Yeah, that brings to mind that, some people are receiving both Medicare and Medicaid if they have income of less than $1,020 in a given month. And if they have, if you could potentially, if you have both Medicare and Medicaid, more often than not, the state of Illinois will pick up your Part B premiums and pay those premiums for you, so you wouldn't have to pay for it. Again, Medicare is always the first payer for any many medical bills. So if you have $1,020 or less in terms of income, you could potentially have your Part B premiums paid by the state, because the Medicaid is a state-run program, as opposed, and Medicare is a federally run program. Now, if you have over than $1,020 in a given month, you have to spend that, whatever income that you have in excess of that, down to that 1,020 in order to make yourself eligible for Medicaid again, and then again the state will pick up your premiums for Medicare.
And Jen, if I'm not mistaken, that program is called the QMB program, which
Yes.
stands for Qualified Medicare Beneficiary
That's right.
Program.
That's
So
right.
if you're going into your local public aid office to inquire about that, that's what you would inquire about. You could refer to it as QMB or Qualified Medicare Beneficiary, and they will know what that is. So I did also want to let our guests speak a little bit more today, because starting in April 2018, Medicare started mailing out new Medicare cards to all people who are eligible for Medicare, to help protect you from any identity fraud. Fraudsters are always looking for ways to get to your Social Security number, so the Social Security numbers were removed from all Medicare cards to make them safer. The new card will have a new Medicare number that's unique to your particular person. The new card will help protect your identity and keep your personal information more secure. Your Medicare coverage and benefits stay the same. Nothing changes except for the card and the ID number. And then there's more good news, because Medicare will automatically mail that new card to you at no cost to the address you have on file with Social Security. So it is very important that the address we have on the record for you at Social Security is your current living address. Otherwise, you may not be receiving your new card. You are able to change your address, whether it's through our 1-800 center, in person, in an office, or you can also set up a My Social Security account at mysocialsecurity.gov, which would allow you to print a benefit verification letter, check your benefits, change your address, change direct deposit, order yourself a new Medicare card at your own convenience. There's nothing that you need to do. So again, if you need to update your official mailing address with us, you can visit us in an office, call us at the 1-800 center, or visit us online at mysocialsecurity.gov. Once you get the new Medicare card, there are 3 steps that make it harder for someone to steal your information and identity. You should take these 3 steps. Destroy the old Medicare card right away. Use the new card. Doctors, healthcare providers, plans approved by Medicare know that Medicare is replacing the old cards. They're ready to accept your new card with your new number whenever you need to get any care. And beware of any people contacting you about your new Medicare card and asking for your new Medicare number, personal information, or to pay any fee for your new card. Treat this Medicare number like you treat your Social Security number. Medicare will never contact you uninvited to ask for your personal information. Please keep that in mind. That is very important for the safekeeping of all your personal information. So for any information regarding the new Medicare card, if you have access to the internet, you can visit the Medicare website at medicare.gov/new card. So Brenda, would you like to tell us a little bit more information about the new card? Maybe we can see what it looks like.
That would be great. So it's still going to be the red, white, and blue card that people normally understand their Medicare card to look like. We're going to show you what it looks like here. So I know it may be a little hard for you to see very closely, but the very first thing you notice is it's still a red, white, and blue card. We are just starting to mail them out nationally, especially for people who are new to Medicare. They may have already started receiving this card last month. We're going to start mailing those out in just a few more weeks here in Chicago. So we want to make sure that we're getting the word out on what this card is going to look like. It does not change your Medicare benefits in any way. It's still the same Medicare program that you had before. But what you are going to notice is it only has your name and the dates of eligibility for Medicare A and B. And then it's going to have a new number. So that new number is the Medicare Beneficiary Identifier. We're going to name it the MBI. The previous name for the Medicare number used to be a health insurance claim number. So you may be hearing about that term as we start rolling out more of this outreach message. So hopefully you're going to start seeing commercials and flyers in your maybe senior center or community center. Keep in mind that this does not change your Medicare benefits at all, and it is going to be coming very soon to your address. So that's why it's so important to make sure that you understand your address needs to be updated with Social Security. There's still time to update your address if you need to. You can do that by hopefully doing it online on your Social Security account, or by calling their 800 number, or by going into one of their field offices. The new Medicare card is going to be really important to try to stop fraud. There's always going to be a reason for someone to try to have fraud with our Medicare seniors, and this is going to probably be another example of people trying to scam seniors. We got to be alert. We got to make sure that we're smart about our Medicare number and use some basic skills to see if people are trying to scam you with the new Medicare number. You don't have to pay for your Medicare card. You don't have to pay for your Medicare number. You don't have to do anything. We're going to mail it to you automatically. It's going to be free. It's not going to change your Medicare program at all whatsoever. And maybe if your neighbor receives it before you, that's because we have to mail 60 million Medicare cards. It's going to take a little bit of time. So it's going to take a few weeks to roll them out in Chicago. Be patient. We're going to go ahead and use both numbers if we need to, your old Medicare number and your new Medicare number for an entire year until April 2019. So if you don't get your card by this summer, then you can call 1-800-MEDICARE. But we're going to be mailing it to you this summer. Keep your eyes out for it. If you have any questions, you can always call 1-800-MEDICARE, 24 hours a day, 7 days a week, in English and Spanish or any other language. And just make sure that you don't share that Medicare number with anyone. Carry it in your wallet if you need to go see a doctor or if you have a medical appointment. Otherwise, treat it like your passport. You leave it safely at home unless you actually need it that day. You don't share it with people who don't have a reason to have it. And make sure that when people are asking you for it, it's for a legitimate reason, for someone that you are already receiving or planning to receive care. There's no other reason why someone would need your Medicare number unless they're your Medicare provider. No one should be calling you for that Medicare number unless they already have a relationship with you and you recognize them, like your own doctor's office. And most importantly, just if you have any question, call 1-800-MEDICARE. Thank you, Joanna.
Thank you, Brenda. That was a lot of information that's very helpful, I think, for all of us. I did also want to mention a couple of other do's and don'ts as far as the new Medicare card and just Medicare in general before we wrap up for today. Remember that nothing is ever free. Don't accept offers of money or gifts for free medical care. Ask questions. You have a right to know everything about your medical care, including the costs that are billed to Medicare. Educate yourself about Medicare. Know your rights and what your provider can and can't bill to Medicare. Use a calendar to record all of your doctor's appointments and tests or x-rays. Then check your statements every month to make sure your statements are correct, the details are correct. Be wary of providers that tell you that the items or the services aren't usually covered, but they know how to bill Medicare so that Medicare will pay. Make sure you understand how your plan works before you join. Report any suspected instances of fraud that you may think you see, as Brenda mentioned earlier, at 1-800-MEDICARE. Don't allow anybody to accept your doctor or other Medicare providers to review your medical records. Don't contact your doctor to request a service that you don't need. Don't let anyone persuade you to see a doctor for care or services you don't need. Don't accept medical supplies from any door-to-door salesman. And just remember, don't be influenced by certain media to advertising about your health, and don't give your Medicare number to anyone. Thank you for being with us today. We're out of time for today's show, and we'd like to thank everyone for watching today's show, for tuning in to this week's episode of Social Security on CAN TV. Thank you, John. Thank you, Brenda, for having us. Have a nice evening, enjoy the weather, and see you next time.
Good evening, everyone.